Psychosocial dimensions of assessment. This is the assessment the teachers often ignore, which is very much important in the development of the children. Let us assume a situation in which a teacher is teaching the parts of a plant and conducting the test after this is being taught. But many students could not demonstrate their knowledge. What could be the reasons? If we ask the questions, many teachers would complain, saying that the students did not pay attention, they were irregular due to their health problems, or some teachers even will admit to their learning experiences provided in the classroom. These alone could not be the reasons for the students' poor demonstrations of their knowledge in a particular area of learning. This may be due to their mental health, the mental conditions that had been affected by the social groups around them, such as family, neighborhood, school, peer group, religious institutions, community, etc. These factors or the social groups through their behavior could have interfered with their learning experiences. This may have brought some kind of anxiety disorder in the children, panic disorder, self-esteem, self-efficacy related problems, poor optimism in the children, schizophrenia, depression, social phobia, obsessive compulsive disorder, substance abuse, etc. These may be identified by observing their behavior that would be manifested in behaviors such as introversion, seclusion, withdrawal, apathy towards others, bullying others, extreme love or infatuation, hatred, anger, etc. The teachers need to identify the students with these problems, and these problems may have arisen out of some factors in the family or society, such as upbringing of the children in the family, broken family, alcoholism, loss of parents, substance abuse, sexual abuse, children working as domestic servants, children's order in the family, gender of the children that may have brought some kind of gender bias in the family, war-related issues, ethnic conflicts, political problems, etc. So the problems might be from the society, from the family, or the school. This may result in behaviors such as disobedience, non-cooperation, disrespectfulness, gender disparity, class disparity, communal disparity, aggressiveness, inferiority complex, superiority complex, intolerance, violence, isolation, etc. These behaviors, once experienced by the teachers in the classroom, the teachers should not make judgments on the basis of what is being observed, but they should try to understand the hidden problems in the children that could have caused all these problems upon the children. So, assessment of the family background and the behavior manifested in children are very vital for the teachers to understand. But there is a question how the teachers would assess. There are various assessment techniques available which had been understood by the learners. Now we would list some of which here for reviewing what we had gone through, such as observation, learner profile, interaction with the parents, interaction with the student, showing intimacy with the students to understand the hidden problems of them indirectly using projectile techniques through role play, through interview, from focus group discussion, using some of the tools and techniques which we would list, such as depression, anxiety, stress scale, Hamilton anxiety rating scale, drug abuse screening test, self rating depression scale, the post traumatic stress disorder checklist, rating scale, inventory, questionnaires, attitude scales, sociogram, etc. Therefore, the teachers need to know how to collect the information related to psychosocial factors. The teacher should know who should collect, from whom to collect, when to collect, how to collect, what tools and techniques ought to be employed, and why to collect, and what should we do after collecting the information about the students' problems, and so on. Sometimes the after the identification of problems, the teachers may have to take some intervention activities by referring the problematic students to counselors, doctors, psychiatrists, psychologists, etc. Sometimes the schools should conduct camps to identify the students with problems, inviting experts to deal with the problems in general, or some kind of group counseling or group guidance activities or group motivational activities could be done by the schools by inviting experts from outside. Similarly, group activities and spiritual development programs would also help in overcoming the problems which are related to their mental health issues. From this topic, the teachers should understand that failure or failing to perform as we targeted with the learning objectives would not be caused only by the students' average intelligence or below average intelligence or the teacher's inefficiency in handling with the students, but there are problems other than these two factors or very few factors. Therefore, teachers should have awareness of various symptoms to identify the students with problems. They should know how to deal with their emotions, how to bring back the students to normalcy or resilience, developing positive attitude in the students, making them adaptive to the atmosphere by bringing changes in the atmosphere as well as students' mental conditions, providing a great feeling of security in the school atmosphere, letting them understand the worth of themselves, or to let them realize that they belong to the school and everyone is the member of this school and classroom, and thereby everyone should have the sense of belongingness. This is also implying to the teacher that the teacher should understand the attitude, feelings, beliefs, experiences, reaction, and the past history of the student that had brought some problems in the mind that should be rectified. This requires the teachers to also change their attitude, feelings, beliefs, and reactions towards all these problems.